technology developed by our research group provides a new method for a controlled release into the brain through the intranasal administration of drugs that bind more than 95% to plasma proteins, which include albumin and alpha-1 glycoprotein acid. The present invention is based on the discovery that the intranasal administration of drugs that act in the central nervous system and bind more than 95% to plasma proteins increases drug systemic bioavailability and sustains drug distribution into the brain and peripheral tissues when compared with intravenous injection. As a proof of concept, the antidepressant drug sertraline, which binds 99% to plasma proteins, was herein loaded in a thermoreversible gel and then administered into the nasal cavity of male CD1 mice. We discovered that sertraline attained higher systemic exposure and exhibited a more sustained distribution into the brain compared with intravenous and oral routes. Moreover, despite its higher systemic exposure, sertraline distributed to peripheral organs, including the lungs, in a considerably lower extent, and therefore its side effects are expected to decrease. Hence, our strategy claims a higher systemic bioavailability with lower peripheral distribution, a sustained brain drug delivery, and importantly, it reduces the peak-to-trough fluctuations of steady-state brain concentrations. This invention has other advantages compared with currently available therapeutic options. For instance, it requires smaller drug doses, it enables self-administration and is non-invasive, it reduces drug-drug interaction potential, it involves a cost-effective production, and it allows other drug formulations and devices to be used. In the near future, we expect to include additional drugs that act in the central nervous system and bind more than 95% to plasma proteins, and therefore extend this innovation to other unmet therapeutic needs, which will include neurodegenerative, neuropsychiatric, and neurological disorders.